Would you kindly give the Commission your full name and address, please?
My name is Phillip Brownley, Eldridge. I reside in the London Borough of Hounslow.
And you've provided a statement.
I have indeed.
Can you confirm that the contents of that statement are true to the best of your knowledge and understanding, and that you wish them to stand as your evidence to the Commission?
I wish them to stand as my evidence to the Commission.
Now, first of all, as I understand it, you have a dual role as both a patient and a patient representative. Is that correct?
That is correct.
First of all, in your patient rather than representative role, can you tell us about your experience at West Middlesex University Hospital, please?
Yes, I'm in the renal clinic there, run by Imperial Healthcare, and I give, every 3 months I have a blood test and I visit the renal specialist nurse. On June the 15th, I met her last year, and she indicated to me that my lipids were so out of control that they completely blotted out the blood test I'd taken, so they couldn't take any readings from it whatsoever. She then put me in contact with the lipid clinic. A letter was sent to my GP, and I was meant to be contacted by one or both of these for a review. Nothing happened, and on September the 20th, I flew to Malaga and checked into the Costa del Sol hospital because I have joint social security in Spain as well, and they confirmed that I had the usual problems that a 20-year diabetic would have.
And what do you say that tells you about the communication between the services here?
Negligible, non-existent.
And is that something, because I'm presuming you've had contact with the services over some years, is that something which has happened in the past, or is it a more recent development?
In my opinion, it has got worse since 2010.
And what do you say should be done to remedy it?
Well, there appears to be a constant change going on, and the providers of services sometimes fail to deliver what they're being paid for, particularly Hounslow and Bridgman Community Healthcare. In the sense there was no diabetic specialist nurse at West Middlesex University Hospital, as there was meant to be, and for which they received payment for over 93 days last year.
You say 93 days, that's a very precise figure. Is that, where does that come from?
It comes from my observations. I spend, as I go to clinics there, I spend a fair amount of my time there, and I get to know staff, and I talk to them, and I ask the questions that enable me to have an informed opinion as to what is going on.
Thank you. I'd like to ask you a little bit now about your experience on the patient representatives groups. Now, first of all, can you explain what your role was on these panels and whether you were involved in any decision-making functions?
I first started for the London Borough of Hounslow in 2011 when they tendered for public health provision, and some of the officers involved in the London Borough of Hounslow transferred to Hounslow Clinical Commissioning Group, which took over the role of Hounslow Primary Care Trust. And one of the staff contacted me and asked me would I like to be on a tender panel system, and I volunteered. I was also put on a patient and carer education programme for 4 months as well, to enable me to fully understand how the NHS works.
Now, you say that you're involved in a number of panels, and one of them you set out is the Urgent Care Centre panel. Is that correct?
Yeah.
Can you tell us what that looked at and how effective was it?
Well, it sought tenders from interested parties to provide an urgent care centre attached to the West Middlesex A&E. Our role was to receive a bundle of documents from each potential, what they called the pre-qualifying questionnaire stage, and from that would be chosen those who could go through to an invitation to tender, or the ITT stage. It was very much based on examination of documents and then asking representatives from the various institutions to come to us and explain their policy. But in both the London Borough Hounslow and Hounslow Clinical Commissioning Group, there was very little concrete evidence. It was, if I say on one project, which was the out-of-hours GP service, I received at the ITT stage 960 pages of documentation relating to 4 bids. And what happens is that the bid process appears to be, you have to put in the correct statements, like we're all in favour of shaping a healthier future. You'll be kind to your staff, you will have multilingual facilities, and you will engage in career development. And it appeared to be just this. In hundreds of pages, there was never any attempt made to determine as to whether or not what they were saying was actually true.
Pause there a moment. Are you saying that that was specific to one particular tendering process, or is that something you say went across the board in a number of the tendering processes?
It goes across the board because the clinical commissioning group in particular is not interested in judging whether or not the winner of the bid is suitable on the basis of their prior actions on other contracts.
Now you say that there was a lack of expertise and experience amongst the CCGs in dealing with procurement and tendering. Is that something that you discerned from your observations, or did you make specific inquiries as to whether people had the relevant skill sets?
Well, it came from observations. When I was a younger person, I was a management accountant in a company that supplied the automotive industry, and when we wanted to supply £5,000 worth of goods, we were subject to a three-man team from Ford Motor Company who would take our enterprise apart. When I was sat on these panels, we have people who are sitting on the panels and giving us advice. I would refer to the Diabetic Intermediate Care Panel, which first started in 2013 and finally finished in December 2014. And the reason for that was that the management accountants and the NHS employees were unable to comprehend that the TUPE provisions in...
Pause there a moment, just for anyone who doesn't know, can you just tell us what that acronym is?
Yeah, transfer undertakings provisions.
Thank you.
It means that people who are in a business that is transferred to another owner or operator have their benefits and rights carried across to the new employer. So we went through a process of pre-questionnaire qualification, and that was it. And then we were going to discuss who we're going to have at the invitation to tender stage, and we were called into a meeting at 5:30 at night. We're told that it was all highly hush-hush secret and we mustn't mention it. The entire contract had collapsed because the financial expert who was employed by Hounslow Clinical Commissioning Group had forgotten about the TUPE provisions, which meant only the incumbent could win the contract.
Pause there a moment. Are you able to recall and say which financial consultant that was?
That was a gentleman called Mr. Symington, Quentin Symington.
And are you able to say on what basis his expertise was sought?
Well, he has one of those histories. I did a case study on him, and it came to 13 pages. He's employed at multiple clinical commissioning groups, it would appear, all over southwest Surrey and the home counties. And his advice was sought. It was erroneous, and I'm rather surprised given his history of working for NHS England.
Are you able to help with whether or not anyone who was on the panels that you were on had enough knowledge about tendering processes to know whether or not the advice they were being given by outside consultants was sound or not?
No. The man in overall charge of it was an interim manager, which means he's part of the NHS warehousing system, and he's moved in and out of locations. And the rest of the panel, there appeared to be some, I'm not being derogatory here, office staff who had low-level skills. They were very good probably on Excel and Word, but nobody had any experience in the private sector, and what they were trying to do was to imitate the private sector.
In your role, did you have any decision-making power, or were you there in an observing capacity?
Well, allegedly, according to the standing orders of Hounslow Clinical Commissioning Group, we have to be present to make any decisions valid. I found out very shortly that you, as a patient representative, I was given a part of the tender. I wasn't given anything relating to finance, staffing, IT systems, all of these areas. And as I pointed out to the managing director of Hounslow Clinical Commissioning Group, had I been shown the financials, I could have pointed out to them that they had a problem with TUPE.
Did you ask why you weren't given that documentation?
We were considered not able to discuss it. We couldn't bring the right approach. I would like to make reference to a further thing. I tried to get the performance of the incumbent of the Diabetic Intermediate Care Service, And I asked the managing director and the chairman of Hounslow Clinical Commissioning Group for these figures, the actual figures of how they were performing on a monthly basis, because they had to report to Hounslow Clinical Commissioning Group on a monthly basis with a series of key performance indicators. This I started asking last May 2014, and I finally received them in March 2015 when I served a Freedom of Information Act request on Hounslow and Richmond community healthcare. They were adverse responses in many areas, and this I thought was essential information that should have been provided so as we could so design the tender to avoid this happening again.
And are you able to help where that particular tendering process has got to?
Yes, it's been the new contract has been awarded, and they start, I believe, May the 1st.
And do you know, are you able to help with whether or not you feel that's an appropriate appointment or not?
We have specific problems in the London Borough of Hounslow. What I have my concerns about the contract is that I feel very much like hostages were put on the front of a train to stop the guerrilla fighters blowing it up. And I was a fig leaf, as a way of pandering to the need to consult with the patients, given if you've read Francis 1 and 2, patients first and foremost, there should have been a greater patient involvement and role in deciding. But I was actually removed from another tender panel on the instructions of the interim manager.
Can you explain the basis on which you understood your removal to have occurred?
Well, it happened I was appointed to the panel to provide out-of-hours GP services for both the London Borough of Ealing and the London Borough of Hounslow. And this started in 2013, and in March 2014 I attended a meeting on the 31st of March at 12:30 to be informed by the interim manager that she was going to Australia for a month's holiday and it was cancelled. So I did sort of suggest to her it would have been nice to have been informed prior to her making the journey. I then heard nothing more, absolutely nothing, until I was in the Lambton Centre here, at the Civic Centre, and the same interim manager walked up to me with a piece of paper and said, I need you on August the 22nd and 21st to attend the tender panel on the out-of-hours GP services. This is when I received just over 1,000 pages to read in 15 emails and 129 files. I felt that I had concerns about it, and at the meeting the interim commissioning manager actually expressed that she thought I was unrepresentative, unprofessional, and shouldn't have been in the room anyway.
What then transpired that led to your removal?
As far as I can see, she did not like anybody who had an independence of mind. I'm rather a questioning person.
Were you the only patient representative, or were there others?
No, there was one from Ealing, but according to their own standing orders, there's got to be one from Hounslow and one from Ealing, because it was a co-commissioning.
So is it have I got this right then, that if there was no patient representative from one borough, does it follow then that a decision that was made in the absence of that patient representative was not a correctly constituted decision?
Yes, in my opinion it is, yes.
And are you able to help with whether or not, and you may not know this, whether or not other panels proceed either with or in the absence of patient representatives?
Well, they may well have done. I haven't got a complete list of how many panels they've had and who's attended them. But it is interesting that the Ealing Health Watch representative who was there actually remonstrated with the interim manager, to say that he'd brought up this issue 5 meetings prior.
Now, I just wanted to ask you a little bit about the use of outside consultants, and we've touched on that already. Do you know how those consultants were chosen and who had control over the decision to bring them in?
That would have been down to the senior management team at Hounslow Clinical Commissioning Group. One gentleman whose company is called Musso Limited. I've met him when I was working at the London Borough of Hounslow, and he's now here. In fact, on the out-of-hours GP services, he was acting on behalf of both Ealing Clinical Commissioning Group and Hounslow Clinical Commissioning Group. which I thought was a conflict of interest there.
And are you able to say whether there was any consistency as to the outside consultants used? Were they the same for the different tendering exercises or not?
Musso Limited is a household fixture at Sovereign Court.
And do I take it from that they were the favoured, the preferred consultants? I beg your pardon.
Yes, he acted as a mediator on the scoring of each tender panel submission, and I thought at the time that it gave him undue influence, since he was very much prone to swinging it to one way or another. And it did occur to me that there was concerns about corrupt practices here.
Can you expand a little bit more on that, please?
Well, if he has links, see, we don't know what his other links are. He's acting on behalf of Hounslow Clinical Commissioning Group, and he was also acting on behalf of Ealing Clinical Commissioning Group. So who had the priority? Whose interests came first? It's very difficult, I think, to represent two arguments. It's like having a solicitor representing both the defendant and the claimant. You know, it doesn't happen. There is a problem that these people are well established within the NHS hierarchy of individuals. They all know everybody. All the people at Hounslow Clinical Commission Group at the top have come from Hounslow Primary Care Trust. So they just transferred across. If you looked at the Primary Care Trust's outcomes, you would doubt the wisdom of appointing the people who drove Hounslow Primary Care Trust into the ground.
Can I ask that we move on a little bit? You raised the issue of fragmentation. Can you just expand for the Commission on what you say is happening and what the effect is, please?
Well, the effect is that the NHS services no longer come from one source, they can come from multiple sources. And the problem is that all the service providers who tender for these all have to have teams of individuals who are well versed in NHS policy. They have to be familiar with France's Patients First and Foremost, Safeguarding a Healthier Future. They have to have all of these things lined up, and that means that the tenderer has to have an estates department, because when they come into Hounslow, they may not get access to the facilities like the offices, surgeries, practice areas that the incumbent has. So therefore they have people who are versed in dealing with estates. They then have to link their separate IT system to Hounslow's system. So there's further discussion there, and there are complications because we don't have a universal medical record system in this country. You have System 1, you have a EMC, I believe, and you then have in the health centres, they use Rio. So every time there's a movement, you're having to link differing computer systems, and it causes problems.
Are you able to help with what it causes in terms of resources and funding?
Well, if you want to tender for an NHS contract, you have to take on staff, and you've got to pay them whatever the going NHS rate is, otherwise they won't move to you. So what has happened is that another layer of a cost has been put in to the NHS in the sense of the clinical commissioning groups. They have a budget level. They're not meant to spend more than £25 per person in their location per head on their administration. Now, that adds up to quite a lot of money. And the problem is, of course, that I've looked at the hospital accounts, and the hospitals and hospital trusts, foundation trusts, aren't shedding staff. So in fact, the cost of running the same NHS service with no increase in requirements or demand is going to be greater because of the inefficiencies of having 5 teams of people who go around looking at the estates provision, and then 5 teams of people who deal with IT.
Finally, you talk about shaping a healthier future as a utopian policy. What do you say is wrong with having utopian vision?
Well, because if you go back to Thomas More, he came up with a utopia which was an island surrounded by water where there were no other influences. Utopianism essentially is to project for a better future without any realisation that the concrete reality of the present is going to stop you achieving what you want.
So in the current economic circumstances, realistically, if changes are needed, what do you say should be done?
Well, we need to deal with the major problem is that 70% of the NHS's revenues go to the hospitals, the secondary sector. We need to change the primary care sector because it functioned very well in the time of Dr. Finlay in Tannock Bury, but it no longer serves in a modern urban environment. The reason why parents take their children to the A&E and not the GP is because they can park at the A&E, particularly at Westmead. It has a large car park. It's easy to get to. A lot of our surgeries are in residential streets and semi-detached houses. As a person with impaired vision, I have an access problem there sometimes because they have ramps and steps, etc., etc. That we should have, I think, 5 clinical centres within the London Borough Hounslow that people go to, and they should be manned 24/7. That's key to those functioning. It's very much on the Spanish system of ambulatorios, which are open 24/7, and the GP, doctors there, clinicians, nurses, they can do all sorts of minor surgery. It's much more effective in a modern environment.
And finally, you refer to Morrisonian principles. How do you say that those are applicable to the problems faced by the National Health Service in North West London today?
It's got too large. It's filled with people who are always looking at the entire region. We need people who can focus on the locality and can therefore determine what the locality's needs are. If you look at the joint strategic needs assessments which are produced by all councils, if you read the Hounslow joint strategic needs assessment, the emphasis is on diabetes. If you go to Hammersmith and Fulham, their emphasis is more on liver disease and HIV/AIDS. And so they're all very different. You know, no CCG is identical in that sense in the terms of the problems that it faces.
And what do you draw from that?
That we need, in the old days, in the times of the London County Council days, LCC ran 42,000 hospital beds in the Greater London area. And I think that's a better mechanism for providing healthcare to everybody in the capital rather than a select few who have the ability to get better treatment than others.
Thank you. If you'd like to wait there may be some questions from the commissioners.
Yes, thank you very much. I have one question. It relates to your observations about the Hounslow CCG staffed by people with no experience of procurement or evaluating tenders. The question is this. Who exactly were these people and how many of them are there?
Well, the panel for the Diabetic Intermediate Care Service had about 11-12 individuals on it when it was fully staffed. Not all individuals turned up. There would usually be 2 or 3 doctors, GPs, who are part of the clinical commissioning group, and then there would be staff within the clinical commissioning group. There would be a patient representative. I never saw anybody from Hounslow Health Watch ever appear anywhere whatsoever. And that would be it. And myself, patient representative.
Yes, thank you. No, thank you very much. It's very kind of you to come today.
Thank you.